River blindness is a disease that is spread by black flies. It is caused by parasitic worms that spread through the body and intercept the eye, causing internal blindness. The spread of river blindness is linked to the location of the black flies. These flies are naturally found near rivers in tropical areas. This is why about 90% of the disease occurs in Africa, which has a tropical climate. The person who is infected by onchocerciasis suffers chronic debilitation. The disease is caused by a worm, and that worm is spread from person to person, not by personal contact, but by little biting flies. These flies are quite tiny, and these flies feed on your blood. So when they bite an infected person, they take up some of the baby parasites, and when sometime later they bite an uninfected person, they transmit those parasites to the uninfected person. The life cycle is started, and those baby parasites turn into adult parasites and produce babies of their own, and so forth. The symptoms are caused not by the adult worms, but by the baby parasites that are living in the skin, and most importantly, the eye. Elimination of the disease is possible with continuation of the current types of programs, and could be eliminated as in the next 10 years or so. African Program for Onchocerciasis Control, APOC, will stop its funding towards river blindness at the end of 2015, and so far there have been no solution put in place. The goal was to clear onchocerciasis in Africa by 2025, and now the chance of reaching that goal looks worse. The support will not stop completely, but it's a huge blow to the project of clearing onchocerciasis in Africa. The reason that funding is stopped is because the developed countries have lost their urge to donate. The amount of money that is being donated each year is a couple of $100 million. That money goes towards running the control of onchocerciasis in Africa. The money is no longer available, so the project will stop. Thanks. Worms crawl through the whole body, and they also crawl into the cornea of the eye, which causes people to go blind. When the worms crawl through the eye, that's when the disease becomes serious. All the baby worms crawling around in the eye leads to irreversible scarring in the cornea. About 5% of people who are infected with onchocerciasis become blind. The disease also leads to an intensive itching all over the body. The itching is dreadful, and those have been cases where the person has used rocks or sticks to scratch themselves. By doing this, they have cut the skin badly and have opened up more chances for infections. In 1974, helicopters were flown over 11 African countries and sprayed insecticide in the rivers. This project was called the Onchocerciasis Control Program, or otherwise known as OCP. This worked, and the disease stopped spreading, and people were able to return to their farms. But the only problem was the existing infection carried on. By 1990, 11 out of 30 countries had been treated in Africa. Then, a drug was re-examined that had been previously used for dogs who were suffering from heartworms. They tried the drug in people, and it worked perfectly on river blindness. This drug killed the baby worms in the body and stopped the itching immediately, stopping infected people going blind. Just 1 or 2 pills a year per person is enough to kill the disease.